Dr. Wood, author of the book Miracles in Minutes. The title of this video is What to Do When Nothing is Working. So this is a clinical gem. It goes with my book Miracles in Minutes. Miracles in Minutes in a book about how to get someone out of pain in less than 2 minutes, okay, with specific stretches or exercises. So I've been in clinical practice 21 years as a chiropractor. I enjoy helping people. I enjoy taking difficult cases. And what do you do when someone has, lower back pain, a knee problem, shoulder pain, and all these things are going on at one time? And what can you do to help this person obtain almost instant relief, 50 to 100%? And that's kind of laid out in the book Miracles in Minutes. There are some patients that you'll use exercises with and nothing seems to stick. What I mean stick, so they feel better and then it quickly comes back. It'll feel better and it quickly comes back. So I ran into that today in my office where I'm working with this guy, and all of a sudden we'll do something, boom, the pain's gone, it feels good, and I use almost like a line item veto. In other words, when people go into physical therapy or certain offices, they go, oh, I have back pain, and someone goes, here, do these back pain exercises. Well, what I've found in clinical practice is you better check those exercises, because sometimes they help and sometimes they make people worse. And this is not saying physical therapists are bad or chiropractors are bad or your personal trainer's bad, as sometimes you need to find out if this exercise is helping you or hurting you. And it happens, but you have to check. You can't walk in blind and assume. So today we're doing some stuff on this guy, and it'd feel better, then all of a sudden it would come back. And then I can see, he goes, it's really hard for me, man. I'm just thinking about all the stuff. I got to go do some stuff. I got to da-da-da-da-da. And I can hear his mind's racing. So when someone is very anxious and agitated, sometimes you start to put stimulus or exercise on them, they become even more stimulated. And what this person needs is less stimulation. What was missing and what worked out today that I used when you don't know what to do, when things are going bad, is you just get them down to breathing. And you start working on their breathing and getting their breathing down. You could use Wim Hof method. You could use Qigong. I recommend Qigong in the book. You can get a book called Qigong, Harnessing the Power of the Universe by Daniel Reed. It's a pretty safe method to use. And the other exercise I had him do was I had him do a vision drill. So I had him lay on his back on the floor, and I got a grid ceiling where the ceiling tiles are, and I had him just stare at one spot. And I had him do it for about 5 to 7 minutes. And the purpose of that was to keep his focus on one spot. Because what was happening was his mind keeps drifting off and he can't stay focused. So it's actually neurological too. When you focus on one spot, you can use this for people who have attention deficit disorder. You can use this for people who have anxiety. When someone focuses on one spot, your mind wants to wander off and you have to maintain the focus. Your mind wants to wander off, you maintain the focus. And the oculocardiac reflex and your vagus nerve is all connected from eye-heart type stuff. So if you stay focused on one thing, what happens is your mind calms down and you stimulate the vagus nerve, and they're going to get a parasympathetic effect, or they'll relax. And when people have a lot of pain, they have a lot of tension in their muscles everywhere, and it just won't let go. It won't let go. It won't let go. So by focusing on a spot on the ceiling, you can focus on your thumb and just keep your focus there for 5 to 7 minutes. It'll create a neurological effect of creating peace and calm in the body, and the body will calm down. Then I had him bring the breathing in with the eye focus drill of just breathing deep into his belly and relaxing. So I was getting him out of his, it's called your sympathetic nervous system. Your sympathetic nervous system, you're jacked up, you're blah, 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 and the mind's running and the muscles get tight. The more your mind thinks, the more your muscles get tight. It's just the way it is. So I took him to the deep breathing with staring at a spot on the ceiling, and then when he stood up, the back pain was gone. Okay, and it was sticking now. So In the book Miracles in Minutes, I talk about what to do when someone is in a lot of pain, the shit's hitting the fan, they can't even look left or right, they turn one way or another, and their pain goes from, through the roof. How do you help this person? That if they do a small movement, they're in trouble, and doing nothing, they're in trouble. How do you thread the needle? And I express that in the book. When someone's body is that unstable, they have that much chatter in their nervous system, and their mind's real chattery, and they have that much physical pain. If you find something that works, just do 1 or 2 exercises and do not load any more on their system than that. I would only go to about 50 to 70% of relief. Don't go for 100% relief. Don't go for the home run of trying to get them out of total pain in one day, because what happens is you will overstimulate them, and in trying to make them perfect, 100% relief, you can send them in the wrong direction. You can send them back into pain again. If they can get a window in the mind of, you take someone who's a 10 out of 10 on low back pain, and you can drop them to a 5 or 3, and they start to stick there, then enough for today. Call your session. It's ended. And then you recommend to them that they can do this periodically throughout the day, and I would say 3 times a day at maybe 1 minute to 3 minutes of stimulus. And the purpose of that is to, if the pain starts to come back, is what you want to do is give the brain the window of not making that neurological connection of back into pain, but put a stop block in there of that break the pain cycle, where they can go back down to a 3. And then like I said, throughout the day, you don't want to overdose, which is the Western philosophy is, if some is good, a lot's better, and people have to control themselves. So I teach it in my office, and this works with physical exercise too, and also for people in chronic pain, or even your eating style, is you go back to, how did a baby do it? How did a baby eat? They would eat 5 to 7 small meals throughout the day. So when you physically dose someone who has a lot of pain, if you find 1 or 2 exercises that work, like like I said, the eye drill and the breathing, and they maybe do it 2 or 3 times throughout the day, spread out throughout the day, not did it and did it again and did it again, and that's just overdosing. And they do it, then it starts to create the space, and it seems to work better. You can also use the principle I just laid out of those small little doses of from this finding. So they were trying to find out, what was better, to walk 3 miles at one time during the day, or a person who walked 1 mile 3 times a day. Okay, they both walked 3 miles. This one did 3 miles all at once. This one walked 1 mile 3 times a day. Which one you think had better results? Well, you should say, with 3 miles is 3 miles. It's not. Actually, the person who walked 1 mile 3 times a day had a better result than the person who walked 3 miles at one time. And it's funny, if you study this too, you go into Dan Buettner's book, Blue Zones, and they found out the healthiest people in the world who lived into their hundreds, who still were very fit and active and had great lifestyle, as none of them exercised. But exercise or movement was built into their day. Maybe it's raking leaves for a little bit. Maybe all of them had gardens, so they're out there doing something for a little bit. So movement was built into the day of getting up, getting down, and walking. And just about all of them walked about 2 miles total throughout the day, somewhere in there, not always all at once. So if you use the small dosing principle of, like I said, how did babies eat? They ate small little meals throughout the day. That's also a weight loss principle. If you eat for some people it works better because it helps their blood sugar keep regulated. There's some stuff that say no and some stuff that says yes. But if you do small little throughout the day, it works the best. And this is what I found for dealing with people with chronic pain or serious issues. They have severe pain. They make one little movement. You don't know how do you deal with this patient. I'm sharing with you my clinical stuff. You can also get my book, Miracles in Minutes. that kind of covers this stuff. So if you have the book, I give you the exercises of what usually worked from 21 years of clinical practice. You know, someone from a 10 down to a 3 in 30 seconds, you know, wouldn't you like to have this skill? Wouldn't you like to be able to help someone? Wouldn't you like it if that was you, that you don't have to live in chronic pain and looking for non-steroidal anti-inflammatory drug or an oxycodone or OxyContin or a narcotic? You know, because there's a lot of risk of, you know, becoming addicted to those medications. And also some of the recent legislation, they could be limiting usage of doctors prescribing those drugs. So I don't want you to be in a conundrum of being in pain or having addiction, or you can't even get to the narcotic anymore. How do you deal with people in chronic pain? How do you thread that needle? So the exercises are laid out in the book. I have red lights, yellow lights, and green lights. What does it mean when I have this? The red light, stop doing it. How do you deal with someone that you're taking some of the concepts I have laid out in the book and the shit's hitting the fan, or it won't stick? If the pain goes away, boom, it pops right back up again. The pain went down, it popped right back up again. Look to the breathing. The eye drills I do not have in the book because I started studying that stuff later. But if you focus on a spot, like I said, the oculocardiac reflex and the vagus nerve are connected through your eyes. The vagus nerve is connected everywhere, but it has a real strong branch between the eyes and the heart. And you can find that out through heart math, how the vagus nerve can stimulate up into the brain, into the limbic system, into the eyes, and calm the brain down. Pain doesn't live in the body. Pain lives in the brain. How do you know you're in pain? Your brain's telling you are. So if you can relax the brain and relax the mind by stimulating a part of the nervous system, you can take someone at a 10 down to a 3 in a short time. Qigong breathing, Wim Hof breathing possibly, heart math breathing could be another one, box breathing like Mark Divine expresses from the Navy SEALs. There's 4 different breathing techniques. Which one's the best one, Dr. Wood? The one that works for that patient. Where they learn. I don't treat patients as I dictate to them. I make a suggestion of this exercise, and if their nervous system says, I like that, it's helping me, it took my pain away, and now I can manage it myself, I say, well, you know, Mrs. Jones, this is what's working for you, and let me show you how to use what you just learned for yourself, so now you have control over the pain, and the fear goes away. The other thing is eyes. So a lot of people have a lot of anxiety. Sometimes they'll have a lot of physical pain. How do you deal with the anxiety? Well, their mind, like I said, their mind, they can't keep their mind focused. It's always thinking and thinking, what about this and what about that and blah, 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 blah. And if you think about it, the way thinking goes, if you ever seen someone who has a lot of anxiety, you'll see their eyes going back and forth, back and forth, back and forth, back and forth, back and forth. Like, so if you can get the eyes to focus on one spot and stay with it, the mind will calm down. It's also, like I said in the book, Think and Grow Rich, written by Napoleon Hill, he actually talks about putting an X on the wall for helping people to develop focus, to help them develop wealth, because to become rich or wealthy, you're going to need control over your mind and your emotions, and you're going to need to be able to focus on something for a long time. And today's society, with television and how the screen's split and da-da-da-da-da, and everything everyone has to manage today, it makes their mind very chattery, and that's why there's so much anxiety and depression and chronic pain. So if you focus on one spot and stay with it, it'll help the mind calm down. So I hope this helps you what to do when things aren't going well in clinical practice, using my book, Miracles in Minutes. When the shit's hitting the fan, how do you pull someone out of the nosedive? Deep breathing or eye focus. All right.